do Periscope today. So let me turn this around. Because you guys joined so quickly, it's hard to even keep up with all the people jumping in. Well, except for right at there's California Sherry. It's Swag Monster. Thanks for joining us. We're glad to have you guys be a part of this Ask Dr. Vaughan. It's been a while since we've done one. I think the last one we did, Empire City Ray. Good to see you too. I think it was during the show, Saturday, when we did the radio show. Denego 1969, we're glad to have you. We're glad to have Hearts. And we'll go ahead and I'm glad to be back, able to do this again with you guys and have all you join. Yeah, great to see you too, Empire City Ray. We're glad to have you here. Matt, Addy is here. Good. Kenny, Rom, we're glad to have you here also. So some familiar names, some not so familiar. Kaylin, yeah, there you are. Yes, good to see you too. And we're glad to be back. I'm sorry that I've not been doing too many the last 2 weeks. It's because of, thank you, California Sheriff, for sharing. And Kenny, yes, hey. And Travel Periscope, I'm glad to have you here also. Advice for Insomnia. Now, since you have a travel theme to your Periscope, I'd like to know if your insomnia is travel related, because that makes a difference. So until you give me a response there, I can go ahead and just touch on that. And thank you for the hearts, by the way. You guys are doing that. That's wonderful. And thank you for all of you who are sharing. Insomnia. So when traveling, stationary insomnia. Okay. Yes. Let me go over sleep hygiene. I do everything I can to avoid using medicines for insomnia because they just don't have good effects for the long term. Sometimes it's okay for short term, but even then, we still have problems with side effects from the medicines that are used for insomnia. For non-medical interventions, I recommend that people have a regular sleep location and time, regular time you go to bed and when you get up. We also recommend that that place where you have for sleep be quiet, dark, and comfortable. Regular sleep time, regular waking time. Also not sleeping in other places like on a couch in the living room. Also not having other activities in the bedroom, not having other activities or television or things like, or eating in bed. Don't do that because in the bed is a place for other things rather than for sleep. Fluorescent lights, yes, color of lights can be an issue, especially towards bedtime, but it depends on the wavelength of the lights. It's not just necessarily fluorescent lights, although oftentimes they're the wrong wavelength of light. And so that goes along with having the right environment before sleeping. It helps to have a regular bedtime routine that you do so that your body knows what's coming and kind of winds down for sleep. The other principles include I'm sorry, I got distracted by the question. Not using things to help you sleep like alcohol, because even though it may make you more somnolent or sleepy, it doesn't necessarily give you good sleep. Then there's the problem for when you're awake in bed. You're awake, your eyes are open, you want to sleep. It's been 15 or 20 minutes, you've just been lying there trying to sleep. The best thing to do is to get up, get out of the bedroom, go do something, maybe read. Reading's a very good thing for this because it doesn't disturb anybody else in the house. If you can get somewhere in a room where no one else is trying to sleep, turn on enough light to be able to read. Do it for an hour or two, even though you really don't feel like doing it, you'd rather sleep. Do it. Yes, hi, Princess Mish. And then try to go back to sleep in your bed. It's miserable, especially if you have to get up for work, because I've done this a couple times in the last year when just for whatever reason can't sleep. You're miserable at work the next day. Stay awake. Don't take a nap even though you're tired. And then the next night, you will sleep much better normally. Now, this is for most people. Some people will have serious sleep-wake cycle problems that should be dealt with a sleep specialist. But for most of us, this is going to work for us. And then we'll be able to get a good night's sleep that next night. And usually it's gone away. But it's not good to just lay there awake because then your body's trained to be awake in bed. It actually aggravates the problem. So get out of bed, do something else, come back. So I hope that was helpful. Sometimes use of over-the-counter sleep aids, which usually contain something like Benadryl, can be helpful in the short term, but they have side effects and, like dry mouth and, obviously sedation is a side effect. Blurred vision can come with them too. Some people can have idiosyncratic reactions or unexpected, rare reactions that can be very unpleasant. So I hope that helps with sleep. Travel sleep is different, and that usually is helped just simply by using melatonin as directed. Okay, so we have a lot of questions here. For the fiance who has, Kaylin's fiance, that one will probably not touch on Periscope, but recommend seeing a doctor since it's a specific person. And travel Periscope, yes, you're welcome. We're glad to do that. Oh, Holly, welcome. We're good to see you. Glad to see you. Good to have you here. Trying to say too many things at once. And you know what I'm going to do? I'm going to try to construct my picture, compose my frame here so you guys can see Travis Lloyd's book behind me. Some of you may have been in on the Periscope where Travis and I talked for, I think, nearly an hour on Periscope. I was speaking, he was typing. And he did send me his book. I read the introduction. No, it was the preface. Almost done with the introduction. No, almost done with the foreword. Haven't started the introduction. The first chapter is the introduction. But it looks like it's going to be interesting. Oh, Princess Mish follows Travis. Okay, question from Holly about probiotics, a must take or... No, you don't have to. They're helpful for people who need them. People with normal guts don't need them. And Empire City Ray shares that he's also an insomniac. So miserable existence for people who are in that state. And the ones who just don't respond to these things I've talked about here, the simple sleep hygiene recommendations, they usually have to actually work with a sleep specialist. And sadly, oftentimes they'll end up on medications. Although it does sound like there's a new one that's out that I haven't used yet, but the sleep specialist here in town has. It sounds good. Holly also suffers from insomnia. And that can go along with a lot of other things that we've talked about before with Holly. And interrupted sleep, yes. Interrupted sleep is usually because you're not getting a good deep level of sleep, getting those deeper stages. And has tried a lot of things. And sleep labs. Sleep labs are usually for diagnosing, not so much for treatment. They can find problems. Some people have some serious parasomnic disorders, meaning disorders associated with sleep. I mean, just weird things. I had one patient who had this one parasomnia where he would actually beat up his wife in his sleep, and it was dangerous for her. She was bruised from it, and he was asleep, legitimately asleep. This is a real problem. It wasn't just that they were, brushing it off as, oh, I was doing it in my sleep. No, this was legitimate. He actually was. It's a real problem. And the medication that's used is actually surprising. It's not medication we normally use for sleep. Okay, Matt Addy, left tonsil swells up about 2 days and then will go back down to normal about every 2 weeks. Well, most likely you're fighting off an infection, or you may have a problem with little tonsilliths, little tonsil rocks, or food matter is what it is, getting stuck in a crypt in it, which is awful to have to get out. Danielle, terrible time sleeping. You too. Yeah, I want you guys, if it's not too serious, go ahead and try these sleep hygiene principles, and they're online too. And in fact, something else that's online for helping with sleep is, and you'd have to do a search to find it, but cognitive behavioral therapy, or CBT. Do some searches for CBT and insomnia, and there's some sleep training programs, or commercial programs you purchase for anywhere from $30 to $50. They're supposed to be very helpful for training your body to sleep better. Best way to remove wax from the ears is irrigation or softening it with earwax softener like a Murine product or Cerumenex. Oh, look who came. You don't like it when I do this. Dr. Vaughan. Or actually, the back of his head anyway. And that's it. There he is. Oh, Debrox, that's one. Yes, thank you. Princess Mish, that is one that we also recommend doing. Okay, you're getting people saying hi, doctor, and people laughing and saying hi to you. Docs don't like to remove earwax. I love removing earwax. I just don't like to have to because people were packing it in there with a Q-tip. Okay, so I guess I'll turn it around since all we're getting is the back of your hearts. If you had your own Periscope, you'd be like more hearts than any other doctor on Periscope. But no, he just gives me the cold shoulder. All right.
I'm giving you hearts because I'm a giver.
You're giving me hearts because you're a giver?
Yeah.
You're too kind. Okay, so he'd be a rock star. That's what they're saying. You'd be a rock star on this. Better for the patient to keep earwax because it's protection. It is protection. The only reason you want to remove it is if you're having problems with blockage, which can cause problems with conduction of sound. Can be painful in some cases, and we've had patients who have had vertigo because of the earwax blocking the canal. And we've also had problems with hearing aids working. Again, that's blocking the sound. So no, I don't recommend it for people who have normal ears, and the wax is not a problem. It's only for people that it becomes a problem for. You didn't hear his roach in the ear story. They liked my animals found in ear. Have you ever had animal in an ear?
No.
You never seen one? I've had 3.
Wow.
It was when I was in emergency medicine.
I've had like foxtails and stuff like that.
Foxtails, yep. In fact, I think we have one over in the museum. Couldn't turn around and crawl out. That's right. What?
I had a earplug goes.
Oh, I remember that. I saw that. I think we still have it over there also.
Probably.
Hearing a bit at 50. Just routine testing is about all you can do in that situation to make sure it's not because something's stuck in the canal causing a blockage. So we have 55, 56 live viewers. That's not usual for just a noontime Periscope for us. That's pretty impressive. I'm glad all you guys enjoyed talking about medical topics over the Pacific time noon hour. And also encourage all of you to follow, if you don't already follow, swipe right and follow, or I guess for you it would be swipe right and follow. And also encourage you to listen to Medically Speaking Radio that comes on Saturdays at 10 a.m. Pacific time. You can either get that on Periscope or at medicallyspeakingradio.com. Ear crystals with vertigo, yeah, that's a problem. It's not because you have ear crystals, it's just because they're in the wrong place or behaving inappropriately. And the treatment for those are the Epley maneuvers you can find online. Probably shouldn't be driving and periscoping. Matt, please, I'll do this another time if that's what it takes to have you not drive while we're periscoping. No, that would not be good. So we thank you all for the great questions, good session, and I need to get ready for the afternoon. We're very busy because we're doing our computer system changeover, and it requires us to really cram the schedule on the days that we're not doing it so that the patients get seen. So you guys take care also, Holly. And we'll see you next time. Until then, this is Dr. Mark Vaughan telling you to stay in good health.